Hi, I am from the United States. Hi, I am from the United Kingdom. Hi, I am from Germany. Hi, I am from France. Hi, I am from Vietnam. Hi, I am from Philippines. I am from Maldives. I am from Brazil. And I am from Israel. And we all want Covaxin. Covaxin has become a sensation around the world. And we have a proof to show you how. Hi and welcome to TFI English, the national and socio-political analysis arm of the TFI Media Group. I'm your host Tribhuvan, and in this video I will tell you how Covaxin has become a global sensation. Let's begin. Covaxin has emerged victorious. Covaxin has defeated the naysayers. Covaxin has become a global sensation. People from around the world want nothing but Covaxin to protect them against COVID-19. Covaxin is all set to single-handedly destroy Big Pharma. Anti-India activists, those who doubted India's ability to develop and manufacture vaccines on such short notice, they all have landed eggs on their dumb faces. Covaxin has been validated, and it is about to save the world as mRNA vaccines developed by the US failed to do their job. Covaxin has cleared all the hurdles despite facing stiff resistance from a massive foreign pharma lobby, a dud opposition that plays politics even in a life or death situation, and a brought-out media that leaves no opportunity to target the government through hope. Immediately after receiving a much-delayed emergency use authorization approval from the World Health Organization, medical journal Lancet has now stated that the Made in India vaccine is 77.8% effective against symptomatic COVID-19 infections, as demonstrated by the phase 3 data. The efficacy data demonstrated 70.8% protection against all variants of the SARS-CoV-2 virus. More importantly, the vaccine showed 93.4% efficacy in severe symptomatic cases. The medical journal added that no severe vaccine-related deaths or adverse events were recorded during the randomized trial. On Saturday, one of the United States' most important health professor, Dr. Francis S. Collins, put out a tweet in which he shared information about how effective Covaxin was against COVID-19 and how the Indian vaccine had no safety issues and its data had been peer-reviewed by leading medical journal, The Lancet. He said, Covaxin, an inactivated virus vaccine with an adjuvant discovered with hashtag NIH support, has 77.8% efficacy against symptomatic hashtag COVID-19 and no safety concerns in a published interim analysis of a randomized controlled trial with more than 25,000 adults in India. Importantly, Francis Collins is the director of the National Institute of Health, which is the primary agency of the United States government responsible for biomedical and public health research. NIH is one of the world's foremost medical research centers. It was founded in the late 1800s and is now part of the United States Department of Health and Human Services. Effectively, the United States seems to be steadily setting the narrative that Covaxin is perhaps the safest bet available in the market to protect people against COVID-19. This comes after Pfizer and Moderna vaccines have spectacularly failed at their jobs and have proven to be unsafe jabs with haphazard side effects and reactions. The replies to Francis Collins' tweet were heartwarming. These were not Indians who were appreciating Covaxin, but people from around the world demanding to get Bharat Biotech's jab as soon as possible. One Mike Ferrer replied to Mr. Collins' tweet saying, unfortunately, it has been kept away from us Americans. Bharat Biotech and Ocugen Inc. have been dealing with the FDA for approval for months. Why can we have a choice of vaccine, especially a traditional one that has been proven to neutralize all the variants? Another Twitter user, Stephen, said, everyone is waiting for Covaxin, not just in US, here in Germany. We are waiting for it too. A user from Toronto, Canada said, Covaxin is the only vaccine developed in Delta COVID era and the only vaccine with asymptomatic data as well can be kept for up to 3 months at room temperature at 25 degrees centigrade. This is key for logistics to remote countries and for the distribution. Pfizer and Moderna is 12 hours max at room temperature. A Twitter user going by the name Everest said, thank you for bringing this to light. Covaxin is the result of a successful collaboration between US and Indian scientists and is the true vaccine solution for the world. Let's begin this safe and efficient vaccine home for our children. One user was even willing to fly to India to get inoculated with Covaxin, as he said, "This is the only vaccine me and my family will take even if I have fly India to take it. Even if mRNA side effects are low, why even risk it with our kids?" Steve, another Covaxin enthusiast, said, "It is the BEST, broader protection, optimum for logistics, no SAE, traditional, over 120 million vaccinated, and potentially prevents transmission. The US need Covaxin ASAP." John, who replied to Dr. Collins' tweet, like hundreds of other Americans, said, "I've had J&J 2 times. I hope my next booster is Covaxin. I work in blood industry that supplies raw material for tetanus, hepatitis B, CMV, etc. I know this is best option." Bruce Gallagher, meanwhile, said, "When can we expect this in the United States? This is the only vaccine that I would take." Covaxin, India's first indigenous COVID-19 vaccine, is going to mark the return of India's status as a Vishwa Guru on the global stage. The vaccine's approval for emergency use by the World Health Organization is set to launch India as the savior of the world from coronavirus.